In many rural areas, homes depend on wells to supply for their needs, while the Environmental Protection Agency requires that public supplies be tested to ensure they meet certain standards. Such tests are not generally required for private wells. In the United States, well water testing ensures a home's supply is safe for the family to consume. Several tests that are performed are for indicator organisms and chemicals that show the likelihood of more dangerous contaminants. While these indicator strains or chemicals may not cause illness, they often occur with more dangerous ones, for which testing is more difficult. Their presence indicates potential contamination by such problems as raw sewage, bacteria from the digestive systems of other warm-blooded animals and humans is of grave concern. Labs often perform a total coliform test to indicate the presences of these bacteria in the submitted sample. If these counts return large numbers, there is a greater chance of disease-causing organisms in the supply that can bring harm to those who consume the product. A more specific bacterial test is for Escherichia coli, often abbreviated as E. coli. A positive test for E. coli indicates fecal contamination of wells, while the indicator form of E. coli is generally harmless. The germs that contaminate wells, when it is present, may cause health problems, including hepatitis, dysentery or diarrhea. Owners should note the presence of the indicator E. coli is not the same as the more dangerous strain of the bacteria that often makes the news. Labs generally perform a pH test. This test is quick to perform and determines whether the sample is acid, base or neutral. While a rating of 7 is neutral, higher or lower numbers can affect quality. Non-neutral samples may erode heavy metals, form pipes. This causes plumbing problems and may make consumers sick in the home. Nitrates are a part of many foods, but should be in the pipes of the home, as continual consumption can make you ill. Sources of these chemicals include flooded sewers, septic tanks, animal waste and polluted storm waters. They can also come from farm runoff, affecting the quality of wells in the area. In addition, natural deposits in the area often increase their levels. In some regions, volatile organic compounds from fuel or industrial pollution contaminate wells. The exact spot for which one should test depend on the location in which one lives. If they are a problem in your region, the local health department can tell you the tests to have completed. Some health concerns are regionally specific. For example, heavy metals may be a problem, especially in the western USA. In other regions, there may be specific bacteria which is of concern and for which the sample should be tested. The local health department of the laboratory can help homeowners determine the tests which are necessary to ensure their safety. In general, it is a good idea to test samples of the supply at least once per year. Additional tests should be submitted if one notes a difference in quality or if there have been local land disturbances. With proper well water testing, you protect the health of all living in the home.